Good afternoon, everybody out there. I know that we have just pushed the live button, so some of you guys will be trickling in. This is another edition of our weekly happy hours. This week it is with a friend of mine. I guess I can call you a friend, Mike. We've known each other for a few years now. So he is with TechData. He's our AWS rep, one of our AWS reps, and today we'll be talking about healthcare updates. This is Mike Clarke. Mike, thank you and welcome. I appreciate you joining us.
Hey, great. It's normally I can say from sunny St. Petersburg, Florida, but today we've had some all day of rain, which we always love the rain down here. So Roy and Courtney and Capital Presidents, thank you for the opportunity and for sure the multi-year partnership. So welcome everybody. Thanks for the time on a Friday afternoon. I want to make sure this is hopefully a little bit of fun with taking away some hopefully some pretty good content that's relevant to all of us during these trying times. So again, as Roy said, Mike Clarke, I'm with TechData. I don't want any commercials today, but TechData is not a known name, even though we're a $38 billion company. So think of us as a distributor for the big technology partners such as Cisco, IBM, HP, Dell. And of course, like Roy said, I'm in the cloud, so I represent and have a great time representing AWS, also Microsoft and Google. It doesn't really come up too much, IBM and Oracle, but they're still a player out there. So thank you for that opportunity. Like I said, I've had the opportunity for coming over maybe the last 5 years. I made the change from supporting our healthcare resellers such as McKesson. I was a global client exec for many years and quite frankly picked up, I'm not a doctor, so don't make any assumptions there, but really understood where we were selling all the technology, the workflow, and I always think about it, being down in Florida and looking at my 95-year-old mom coming up, being a consumer. So I really understand, workflows from EMR and PACS, and I'm kind of coming around to make my point why we're here today, is it's always was frustrating, and we all know the love-hate with our whole healthcare system, whether or not it's the challenge of making an appointment, getting an appointment, going in 6 months later. Then you get to fight with your insurance company on what they paid versus the charge from the physician, and so all of that. With all that said, the smart software companies, and McKesson being, I'm always going to be close to them, but for those that keep up with EMRs, it's Epic and Cerner, GE, Philips. They've all had telemedicine modules for over 10 years. But quite frankly, they couldn't push that out to you and me because of, and I don't want them under the bus, but yes, I will. It was the insurance companies. They wouldn't reimburse. So that's been why, quite frankly, telehealth, telemedicine's been on hold, been very frustrating. I was sharing with Courtney and Roy before we started here that I'm a little over the top, glass half full kind of guy. And if I don't like the amount of liquids, I just get a smaller glass and make the day look a little bit better and brighter. And not trying to put any sugarcoating on COVID-19. It's a horrible thing we're going through. But I do see some sunshine coming from telehealth, mainly because organizations in our government like HHS, CMS, especially, even though Florida's not the only one that cares about Medicare and Medicaid, but they've taken the gloves off of all the, and I don't want them all off, but I want them off the stringent rules and regulations around the compliancy coming from HIPAA, from PHI, and that's very important to all of us, and quite frankly, and I'll tie it in, even PCI, because there's always a financial aspect of this. So again, just literally a little over a month ago, March 6th, is when CMS released or relaxed some of the regulations. HHS cut a check to about 1,400 healthcare institutions of the first, that's the key thing coming out of Washington. Roy can laugh on that. The first $100 million coming out supporting telehealth, primarily starting with a combination of our providers, and again, providers being our hospital systems, but more importantly, I think for the physicians that are out there. So, Roy, I don't know if we're going to stop and take questions, if they're going to send in chats. Again, I'm a newbie here to your whole, broadcast. So, keep me honest or jump in at any time.
Yeah, sure. So we have a lot to cover here. Obviously, healthcare is something that affects everybody, and it is one of the big topics with this. Last week we had somebody on to talk about remote readiness and things that you can do when we have this forced telework that people are going through, and how to prepare, and things that you could be doing even when we're not in a pandemic. And then we went over some. We went over a checklist that was kind of like things that you should do around the house, right? And so these were everyday conversations with people, and so healthcare is one that affects everybody, right? And so you've already mentioned some of the things that the HHS has talked about with telemedicine and some of the things that they're doing. And so my big question is, with the COVID-19 and this coronavirus season, and people, this social distancing, and we're no longer seeing our doctors in person as much. At least they say don't go to the doctor unless you're sick, kind of a thing, right? And so there's always innovation that comes out of these type of scenarios, right? I mean, this is not something that we want to be a part of, but if we're going to come out the other side of this, then we have to learn from this, and we have to innovate, and we have to keep pushing forward. So we've already seen some of the things that like the NFL was doing. If you watched the NFL draft last night, then they talked about they had a nice commercial about Microsoft Teams and how healthcare industry are using it to communicate, and how they're using it to have telemedicine where people are spread out across the globe. And if you wanted to see a specialist on the other side of the world, literally you could do that. And so from that telemedicine, do you think that any of that will play after the fact? Do you think some of these regulations and some of the things that we're allowed to do because it's a pandemic, do you think that they're going to stop when the social distancing is over, or do you think that some of these are some of the things that people are going to start pushing for and wanting, and it's going to become the new norm along with this remote work that we're seeing?
Yeah, I don't think the gloves, or unfortunately the Band-Aid, will go back on. I'm going to skip down on my notes on a couple of numbers. Today, the global telemedicine market's about 30 billion. Again, if you look at the top five, the Gartners and all of them, now they're projecting in 4 years it's going to go to 95 billion, and by 2026, which is only 5.5 years, up to 185 billion. So again, I think the gloves are off, and again, it's been, quite frankly, good exposure, but there's so much more. And I'm going to share some real life experiences. And Courtney and I were talking before. It's great to have the cloud providers such as Microsoft and AWS, software companies, making this. Zoom is going to participate along with WebEx and Teams for sure. And Microsoft, by the way, today, if you saw the announcement on the Microsoft plug, they just hired from GE, and I think he was the CTO, to take over Microsoft Healthcare. So again, that combination of technology such as public cloud into a vertical such as healthcare, coincidental? Probably not. But the point is about telehealth, and Courtney and I were talking, it's like, hey, we have to become an extension. If we have the luxury of not going to the doctor's office, we still have to have the same results when we walk away. So I was sharing that, and again, I'm a pretty healthy guy. I run my 3.5 miles every morning at 5:30. So all of that. But I had my primary visit 2.5 weeks ago, and my doctor sent me the link and everything else, and quite frankly cracked me up. And I gave Dr. Toms a little bit of a grief because it was a Zoom meeting. Now, we were only going through my LabCorp blood work, but I said, Dr. Toms, eventually HIPAA and PHI is going to catch up with that and everything else. My next visit was with my cardiologist, my bi-2-yearly, whatever term that is. And he had actually a module from ECW, which is eClinicalWorks, probably one of the top 5 EMRs. And again, HIPAA compliant, PHI, just as important, PCI, because again, there's a lot of times where, hey, they want to be paid. And if you have Stripe capabilities, if you have a PayPal account, you can do it right there. Also, a little side note that anything that you're doing, either with your physicians or imaging anymore, hey, don't be bashful to ask, hey, if I'm a cash customer, is it a better deal than my insurance company? And I guarantee in imaging, 90% of the time, it'll be 50 cents on the dollar. Let me stop there. But let me go back on one more point about extending the physicians to our home office, is that we're going to have blood pressure cuffs. We're going to have a device. Usually your smartphone can handle the beats per minute. Again, a thermometer for the temperature. Again, probably a scale. We would expect, you would hope the insurance companies would send out all of your dock-in-a-box endpoint solutions. Hopefully they would be Bluetooth enabled. So there's a lot of new technologies that have to be applied, both from product, software, services to just telehealth itself. Roy, that was probably a long answer, but there's a lot when you start going in different tangents.
Hey, Mike, this is Courtney. So I just kind of wanted to get your feedback on, who really benefits, their particular providers that, this is really beneficial for. I know this kind of covers a lot of different providers, but is there any particular that really, benefits with the AWS telehealth? And then do you know which insurance companies are covering this right now?
Yeah, let me start with the easier one. Thank you, Courtney. Again, coming down and, it's one of the other funding that came out of DLT, the distance learning, everything. And quite frankly, it's for all the nonprofits and tribes. But it really think about, and I always look in the mirror back in Florida about, long-term care, nursing homes. Boy, talk about the benefits of not trying to get my 95-year-old mom to launch Uber and make it to the doctor's office on time, have all her records and everything else. I mean, that is just the immediate benefits that we can extend that, your primary care out to wherever that person is. And it could be just as much for, small kids who are, quite the joy to get, put in a car and get to the doctor's office. And as far as the insurance companies, I don't have a list, but I'm pretty sure, and I've heard from my provider, United Healthcare, that they're on, and I'm sure that Aetna, the Blues, Kaiser out west, they will be leading the charge with this. And once, and again, the Band-Aid's off, it's not going to go back on. So this is all, just a beautiful thing for all of us. And I think the question that I had posed, quite frankly, to the two of you before, it's like, so where do we go other than just, checking on my blood work, looking at the same screen and all that? I mean, think about, when we get into, how much can we extend out to, dermatology and some of the other specialties. Again, we're going to have to, make some investments, and hopefully that comes from the insurance companies along with the government to try the best we can to replicate that experience and the results from, some of these other, one-off office visits. Let me take a drink here. So I have gone through everything. Can't see my shirt, but I do have an AWS. And today was not supposed to be a commercial, again, but I did want to mention one company, Secure Video. Again, there are a lot of them out there. I mean, if you just Google, you'll see Teledoc, like I've already mentioned, from, all the big EMRs, they're going to have telemedicine modules. But it's nice to have a company that, again, is, and if I'm a consumer, I want to make sure, one, starting with PHI, then HIPAA compliancy. Again, there's going to be financial information transmitted sooner or later, so I want to make sure all the PCI, all those dots are crossed also. So that's really what I had to share from a telehealth perspective. I'll sort of, I'm going to tee up Roy a little bit because I wanted to share internally, even though health path is a little bit of a passion. You can think about TeleXXX, and I don't know the range of the audience today, but I thought about my wife this week. She's a realtor, and she's not loving the results, but now she's doing open houses virtual. So her Saturdays and Sundays, she actually can, spend more time with me. I think I'm supposed to clap at that point. And she just had her closing this week on a person that passed away, and they had the judge on the line. They had both closing agents and everything else. They closed, signed the documents, did the financial transmission, all of that. So think about tele-legal, tele-real estate. Teleeducation for those in that particular vertical, I think that's quite a little bit of challenge, and I'll leave you with this. I don't know if I would want to be coming up with solutions to keep college students entertained or 7-year-olds. I don't know which has the over under on that one. So Roy, as they say, back to you.
Yeah. Well, we're seeing a lot of innovation with, you bring up 7-year-olds, right? And that's the education is having a hard time with this. But I wanted to circle back to something you brought up in your last response, and that's around HIPAA compliance. When we're dealing with PII and you're dealing with HIPAA compliance, and so for those of you who don't know what HIPAA is, it's a set of regulations that providers, doctors, cloud solution providers, whatever it is, you have to protect the data of your patients. And PII, or personal identifiable information, if I'm saying that correctly. I've been using acronyms for so long that sometimes I forget what they mean. But PII is your name, it's your social security number, it could be your address, it could be your birthday, it could be your mom's maiden name. And so these are the things that when you work for government agencies, they tell you to strip away from your Facebook profiles and all of your social media profiles, so that if someone were to try and hack you, they couldn't see that you're related to your mom on Facebook, who, oh, here's her maiden name in her Facebook profile, therefore I now know how to answer a security question against you. So there's a little tip for you guys. But when you're dealing with this HIPAA compliance and this PII, I know AWS has come out. You're in the AWS world, so we'll stick there for now. But the AWS this isn't new to them in terms of the public sector and healthcare. And so if you could talk a little bit about AWS and how they protect, or you don't have to get into the big technicals, but they dealing with data and dealing with PII and dealing with your information, and then how are they helping, or how is TechData helping with some of this telehealth? I don't mean to put you on the spot there, Mike. I know that's a little bit of a spot question, but could you talk a little bit about how we're protecting your data?
Yeah, for sure with AWS, and now they've been around for a while. It's close to 15 years. They were born, out of in 2006. So because they came out of Amazon Inc., and there's a reason I share that, because everything Amazon does, it's all financial. So security has always been over the top. Besides the customer experience coming from Jeff Bezos all the way down. So you bring that down now to especially either sectors such as healthcare and or public sector. I mean, the security is over the top, and that's just from a pure public cloud perspective. And then when you get down into, Roy, like you said, the particular compliances of HIPAA, PHI, PCI, I mean, they check all those boxes, and they could not advertise themselves when they go out to the world, to the public, to you and I. Quite frankly, Epic, who is, for those who know the big EMR, they are by far the #1 EMR player in the US, probably have about, 52% of the market. Epic just authorized that, quite frankly, other than when you buy their Epic software, normally you would get your choice of putting it on IBM, Dell, or HP servers. Now you actually can host it in the AWS cloud. So you get a combination of compliancy checks from not only your software company, but also the technology platform that can be on-prem in the data center or off-prem in a public, cloud such as AWS, that, you and I should feel very well protected. Now, we've all known, we'll see the next CNN that, somebody gets hacked and all that. But quite frankly, looking at the world, AWS is a leader out there across multiple verticals, compliances, and in public sector. That's why they are leading. And Roy, in your backyard, I mean, you look at, and this is quite frankly just a validation of why you should feel good about healthcare at AWS, when the DoD, the CIA, HHS, CMS, Army, the Air Force, the FAA, the Black Ops, boy, somebody will probably be knocking at my door tomorrow morning. But all of those now are in AWS data centers. So again, a little bit of the plug, the passion, because I live and breathe, looking at the company's enterprise all the way down to SMB that feel very, very safe in the partnership with AWS.
Now, Mike, do you see more home devices coming out of this? I know there have been companies prior to this that provide some stay-at-home medical teledevices, but could this be a trend?
Yeah, and boy, great segue. You're making me really think today. I go to the HIMSS conference every year, which unfortunately was canceled due to COVID. But companies such as GE and other big providers, insurance companies, they've been developing endpoint, and just not the obvious like I talked about with blood pressure and everything else. They've been developing, quite frankly, healthware so that they can monitor you and everything else. So think about this now that, after you have surgery, hey, you're supposed to go get, 60 minutes of exercise every day, and people will go back home after a heart attack and they lay on the couch. Well, now all those devices that you're wearing, that t-shirt, it's going to be able to keep track. Did you take the blue pill at 8 o'clock? Did you take the green pill at 12? Did you get 30 minutes of exercise in the morning? Vice versa. Tie all that in. So you think about just not the pure technology endpoint devices, but really looking at it from a doctor and a nurse, and probably if they're out there, they're probably like making funny faces at me. But that's all going to be the monitoring that we can tie in. And boy, then when you have this telehealth checkup, that you don't have to bring in all these notes and paperwork and everything else. Quite frankly, and beware, it's all going to be documented now, just like everything else in our lives. So even though it's exciting today where we're at with telehealth, I think we're sort of the tip of the arrow, as an old saying.
Not to, promote, Fitbit or Apple, but they have the watches now. So like they're tracking your heart rate, they're tracking, how many calories you're burning a day, I guess it's endless, but, going back to, just the devices and all the technology itself has just tremendously advanced over the past couple of years.
And, it's funny, and of course I have my Fitbit here, you can see. So I always used to get my primary, and she's very sarcastic like I am. It's like I would see her twice a year, and we would take the blood pressure. And I would go, I could have just gotten off with my boss, my blood pressure, and here is just a cute snapshot. And at 135 over 90, and you want to write a prescription. It's like, so the point is, now we get a, quite frankly, what's
I feel you, Mike. I understand that.
So now she still may be able to give me some help, but the point is, at least we'll have much more data, or hopefully much better prescriptions. So excuse my humor there, but the point is, it's just going to get better and better for us being the consumer.
No, absolutely.
So, Mike, did you see that in some of the reports they were saying that those wearable watches and devices, I guess Fitbit is one of the names that have been dropped on some of the news, that it's able to read that you're getting sick prior to you even getting sick? I know that it's saving, Fitbit in the cloud and saving some of your data, but I guess, and during this time, they were able to find some people who were, having COVID symptoms or ended up having the coronavirus, and their Fitbit was able to track that they were getting sick, and then able to, help them alert them of some of their symptoms before they even hit.
Wow, that's cool, and you're one up on me on that one. The one area I have been tracking, hopefully to shorten the time that on this, I don't want to say relaxation of social distancing, but it's been about the drones that can cover an area and can, get down, and quite frankly, we're not going to stop the world of drones and all of that, but quite frankly, can do temperature monitoring and can, come down and I haven't seen all the data, but, to be able to pick out an individual that has, and I don't know what the bar is, if it's 99 degrees or 100 degrees, and to be able to pinpoint that person out. So as always, boy, technology consultants, the smart people like Roy, will be thinking about, how do we really, take 3 steps, not just 1 step, on making this a better situation for all. So we got to start with blood pressure cups and Fitbits, but I think there's a lot of people thinking way beyond that.
Hey, Mike, and can you let us know how people can get a hold of you?
Sure. Pretty simple. I'm on LinkedIn, and for out there, simple email, mike.clarke@techdata.com. And I'm not bashful. I live off one phone number, 727-482-5659, and I'm a texting fool. And just know I'm out running at 5:30, and yes, I text a lot on my 3.5 mile run. So thanks, Courtney.
No, thank you. It's great having you.
Yeah, and Mike, thanks so much for hopping on. I know we're right about that 30-minute mark where we want to keep these shows, they're bite size. Last week we did an hour, and I think that's too long for me. I mean, at least. So
I have a favor though, Roy. Thank you for the opportunity for being a guest speaker, but I would like to participate, like in the wine tasting, or maybe the cheese, recommendations. So that's all my give ask.
Yeah. So thank you for bringing that up. So next week I actually have a wine bottle right here with me. So next week we have so this is The Moment. It is a red wine blend from Paradise Springs. So Paradise Springs is who is going to be our guest next week. They are a local business winery, obviously, but they do, tastings, they do events, and they have live music. And, the spring, as you might imagine, for a winery is a really hopping time for them. And so they had to, using different outlets, whether it be Microsoft applications or Zoom or Facebook Live or a lot of this virtual environment, they started doing virtual wine tastings. They started doing different things online, and they're going to be, the CEO is going to be our guest next week, and he was named 40 under 40. So if you're big into wine, Mike, check out next week. I'm sure The Moment will come up. They actually just had a new Merlot that they released. They opened up a new vineyard out in somewhere in California, Santa Barbara, maybe. I don't know. I'm gonna butcher it. I know he's probably, if he's watching this, I'm sorry. But they just released a new Merlot called Effing Merlot, and so that is they're doing a release party for that online as well. I was actually in one of their virtual tastings a week, 2 weeks ago. I don't know. Who knows about time these days, right? It could have been yesterday. So and he he sold me on a wine membership, so I joined a wine club. So I'm a member of a vineyard. My wife and I are now virtually. So when we next time, I'll ship you a bottle, Mike, and we can sip some wine together. You said that you had to take a drink during this. Hopefully, it was a nice Friday beverage and not just a glass of water.
It's still H2O, just in case HR's monitoring.
That's right.
There are 30 minutes till official and everything else. And I will be looking for on the front porch on about Wednesday for my box. So thanks, Roy.
Any particular type of blend? Are you a red wine guy? Or are you a white wine guy?
Anything under the red category, I'll check the box for you.
There we go. All right. And so I guess, Courtney, we can't leave you out of this conversation. So I am having a Friday beverage because this is happy hour after all. So Courtney, are you? There it is.
I'm a beer girl.
Iron Kugel. Yep. So I have a Miller Lite today. Of course it's a Miller Lite. I'm boring. As much as I like to think that I drink nice beer, and sometimes I do, but I'm very boring. And then next week I'm excited because I'll get to drink some Paradise Springs wine with the CEO of the guy who created it. So I'm keeping that one closed so that I can open it next week. Well, Mike, thanks for hopping on. I really appreciate it. Anything you wanted to talk about right before we go? Any announcements over at TechData? Anything you wanted to plug?
Nope. We should be open for business. That was one other thing about our global headquarters are here in Clearwater. 2,000 people have been going to that office for 35 years. Today there's like 20 people there. So it will be interesting to see when we come back to whatever the new normal is, but it won't be 2,000 people going to the office every day. I don't know if it's going to be a week on, week off, but too many people now have been exposed to the world of tele. So changes can be good. So
that's right.
Thank you.
Absolutely.
Yeah, appreciate your time, Mike. As always, you'll probably I hear that we have a meeting scheduled next week, so this is not the last that you've heard of me during this time. For those of you who don't know, us at Capital Presence, TechData is our distributor. So if you're using any of our products, if you're using our cloud, then Mike probably had a hand in it. So appreciate you, Mike, and we'll talk to you soon. So thanks for everybody for checking this out. If you are wondering how you could see the beginning of it and you're just tuning in, you can check us out on our YouTube page. That's Capital Presence on YouTube. We also are on Facebook, where I believe we're posting that as well. So thank you very much. Again, next week we have the CEO of Paradise Springs Winery. So there we'll be drinking some wine next week. So maybe my questions will be a little less thought through and maybe a little more slurred. But it should be a fun time. So make sure you check us out. Thanks again, and see you next week.